कि bypass or stent? Like, how do you as a cardiologist arrive at that decision?
To keep the fluid into the body, we require minerals, salt, and proteins. We require everything.
What is the immediate assistance for heart attack?
Heart attack patients, they will present with chest pain or chest discomfort, which is especially in the center of the chest.
So in short, अगर दिल टूटता है तो जोड़ नहीं सकता है.
Depend करता है, बार-बार जुड़ता है. Hello listeners, I'm Dr. H.S Gilhotra, Director Cardiology, Sohana Hospital.
Okay, thank you for letting me in, sir. First of all, sir, सबसे पहले ये बताइए कि what are the signs of vessel blockage and how it can be identified?
So the blockage in heart vessels, by and large, it will present in three methods. One is heart attack, two angina, and three it can be completely asymptomatic. That's a silent coronary vessel blockage. So heart attack patients, they will present with chest pain or chest discomfort, which is especially in the center of the chest, constricting type. But the pain can be from anywhere from nose tip to umbilicus. And some patients can have dyspeptic symptoms or the gaseous symptoms. Most importantly, a patient of heart attack will have a feeling of impending doom and they will have cold sweats. So these patients should get immediate ECG done and they should seek immediate attention. Most likely the ECG will pick up a heart attack and the one can be treated immediately. Second part is angina. Angina patients, if they walk, they can have symptoms again from nose tip to umbilicus, but they occur on exertion and they are relieved at rest. Such patients can be subjected to a treadmill test, and if treadmill test is abnormal, they should go for an invasive test like angiography. Then picking up a patient who is having a silent heart problem, there is no apparent symptoms, but still we should be subjecting these patients to CT angio in high-risk population, like if somebody is having a long-standing diabetes, somebody is having a strong family history of heart disease. In such persons, if they are going for a competitive jobs, like a competitive sports, or they are going for a high-risk job like a pilot job, then they should be subjected to treadmill test or a CT coronary angiography to find out if they have a blockage in their vessels.
ठीक है सर. और एक बहुत बड़ी confusion रहती है सभी patients के दिमाग में कि bypass और stent. Like, how do you as a cardiologist arrive at that decision?
It's not the technology. The center of the central point is patient. Whatever is better suited for the patient should be offered. We should be offering that to the patient, and we take this decision along with our cardiac surgeon and cardiac anesthetist. That is called a heart team approach. So, if person is requiring simple angioplasty, then angioplasty should be offered. If angioplasty is too complex, then preferably a bypass surgery should be offered until unless the risk of bypass surgery is very high. Say person is having lung problems or there are significant comorbidities which limit that patient to be subjected for bypass surgery, then we should opt for a high-risk angioplasty. So it's a collective decision which should be taken along with the cardiac surgeon and cardiac anesthetist.
ठीक है. And talking about this weather, sir, right now बहुत ज़्यादा peak पे गर्मियाँ जा रही है. So what does this severe heat have an impact on health of the heart?
Extremes of weathers, they are very much detrimental. Our body cools it off by two mechanisms. One is by producing sweat and second is by vessels dilatation. So these two things lead to decreased blood pressure. So people who are having hypertension, their antihypertensive dosage will decrease. Otherwise, if you do not decrease the dosage, then they can have common faint in the market or somewhere once they are dehydrated. And then second part is heat exhaustion. Heat exhaustion will produce significant irritation, sympathetic stimulation, increase in heart rate, and that's detrimental for the heart. Then third part is heat stroke, where your body is not able to give signals to cool off. Their temperature will rise and that can be fatal. One can have fatal arrhythmias and then person requires admission.
Okay. And which drinks do you suggest for treating dehydration?
Well, plain water is not sufficient. To keep the fluid into the body, we require minerals, salt, and proteins. We require everything. So, traditional drinks like sattu, nibu pani, or fruit juices, or the more modern drinks like smoothies, fruit shakes, they are important. So, plain water will not be sufficient, chach or something. You should have something substantial that will lead to a better hydration.
Okay, and खुदा ना खास्ता कभी किसी को हार्ट अटैक आए तो what is the immediate assistance for heart attack?
If somebody is having a heart patient nearby, you can borrow a tablet of aspirin. That should be chewed and swallowed, because mostly aspirin available is enteric coated, so that will take time to act. So that has to be chewed and swallowed, or one can take a tablet of Dispirin and rush to the hospital. So firstly, we have to confirm the diagnosis by going for a ECG and a echocardiography, and if the diagnosis is confirmed, then the best treatment should be taking the patient to the cath lab and doing an immediate angiography and angioplasty. The time is important, because whatever muscle is lost into the heart, that's permanent and irreversible. अगर चमड़ी पे चोट लगती है, चमड़ी रिकवर करती है, हार्ट में सिर्फ स्कार्स बनते हैं. There is no recovery, zero recovery. And if person is not having a cath lab nearby, then he should be given clot buster drugs. But again, timing is important. And if it takes more than 2 hours to reach to a cath lab, then preferably one should be given clot buster drugs.
So sir, in short, अगर दिल टूटता है तो जुड़ नहीं सकता है.
डिपेंड करता है, बार बार जुड़ता भी है.
ठीक है, थैंक यू सो मच फॉर योर टाइम सर.
थैंक यू.